And this session is actually on WHO's guidance on infection prevention and control procedures for COVID-19 vaccination activities. And yes, with the introduction of the COVID-19 vaccine, things are going to be a lot more different than what we usually know, especially because people have to ensure that they respect barrier measures that protect themselves even while administering the vaccine. So we are going to start with a few ground rules. When we start, I'll just invite you, like I said earlier, you type in your city and your country in the chat so we know where you're connecting from. And then we actually invite you to participate actively. So while the speaker is presenting, you're encouraged to listen, to type in your comments on the chat as well as your questions based on what the speaker is presenting. And please do not ask,
Honest, I asked before this.
Okay, so I see our guest speaker is already with us in the room, so I'm just going to rapidly go through the ground rules. So please do not ask to share audio and video unless you are explicitly invited to do so. And so our presenter for today, she's going to introduce herself. This session, we're going to get the presentation from the speaker, and then we'll go to a question and answer session, just to ensure you that the resources for the session are going to be available. So now our speaker for the session is Benedetta Allegranzi from WHO. I'm going to stop sharing my screen and turn towards her. She'll introduce herself better and share her screen for the presentation. So you're much welcome, Benedetta. And I hope I'm getting your name right. I'm going to invite you to unmute yourself and then you have the floor.
Thank you very much. Good morning, good afternoon, good evening, everyone. I'm really privileged and delighted to be with you today to share my presentation and my knowledge focusing on infection prevention and control in the context of COVID-19 vaccines delivery. I need to understand how I can share my screen. If someone can guide me, please.
Yes, I'll be delighted to guide you. So if you look at the bottom of your screen, you'll see a little screen icon, with a red bar across it just beside the microphone button. So you click on that screen. Okay, I see you've already gotten it. So normally you should, yeah, that's it. Okay, great, excellent. So over to you. But we could actually see your screen very well.
Okay, can you again? Yeah.
No, please go back to the slides. Yes, we can see them now. Okay, we can see them. You can put them in presentation mode.
Okay, can you read the slide you can see, please? Because I'm not sure you are seeing the right slides. Could you tell me what are you seeing now?
Okay, infection prevention and control procedures for COVID-19 vaccination activities. Benedetta, can you hear me?
Probably someone is muting me because I didn't touch the microphone. So it seems someone mutes. So
yeah, actually there are interferences.
So can you see my slides again now, please?
Yes, I'm actually seeing your slides, infection prevention and control procedures.
Okay, perfect. So can you also hear me, right?
Yes.
Okay, that's great. Can you just confirm? Can you just confirm that you continue to see my slides?
Yes, even though right now they are on the speaker mode. Okay, yes, we can see your slides.
Okay, perfect. So I should start probably. So again, thanks to all for participating. I would like to specify that this presentation is really focusing on infection prevention and control procedures for ensuring safe delivery of COVID-19 vaccines. It doesn't focus on vaccines themselves, on effectiveness, or on adverse events or other aspects of planning or rolling out the vaccination campaigns. So it really focuses on infection prevention and control. And indeed, this aspect is key as all activities in healthcare, of course, and in particular in the context of the pandemic and in the context of delivering vaccinations in general. As you may know, WHO, together with UNICEF, has issued different documents, two of which are on the screen at the moment. The first one is a guidance on developing a national deployment and vaccination plan for COVID-19 vaccines, which includes a section related to infection prevention and control. But later on, we also issued an additional aid memoir, which is on the screen, that details all procedures from the IPC perspective, and this is the focus I'm going to have in this presentation. However, as an introduction, just reminding you that this general guidance delivered in November 2020 really is meant to provide support to national governments in developing and updating their national deployment and vaccination plan for the COVID-19 vaccines, and it builds upon a number of existing documents which have been developed based on the WHO Strategic Advisory Group of experts, and it also builds upon the COVAX initiative that is led by Gavi, the Coalition for Epidemic Preparedness Innovations, UNICEF and WHO, and it's a mechanism to accelerate the development and manufacturing of COVID-19 vaccines, and then to guarantee fair and equitable access for every country in the world. So in the context of COVAX, there are different initiatives and the development of roadmaps, mechanisms for fair allocation of COVID-19 vaccines, frameworks, and guidance documents that were based upon the input by SAGE, as I mentioned. So this document includes many elements, as I mentioned earlier, in terms of planning, preparing, delivery strategies, identification of the target populations, and all the resources needed. And one of the sections is really containing initial guidance on infection prevention and control. This is section 6 on preparation of supply chain management and healthcare waste. Associated with this document and also with other documents related to the delivery of COVID-19 vaccines, WHO developed, together with UNICEF, developed several training packages for health workers, for managers, for the national and subnational focal points involved in these operations. And you can find all of this on the website of openwho.org. And there are already many registrations, as you can imagine, in these modules. So if we now focus on infection prevention and control principles for safe COVID-19 vaccination, experts and WHO and UNICEF employees and technical colleagues have agreed upon some key principles. First of all, the standard precautions to be applied during any vaccination activity are also valid for COVID-19 vaccine delivery. However, there are some additional IPC precautions that are necessary in the context of the COVID-19 pandemic, and we will see these later, in particular the mask use, which is normally not a standard equipment necessary for the delivery of a vaccine in general. Also, it is important to consider that in the context of these major operations that are being prepared or rolled out in all countries, there is need for specific training for health workers that are involved in these operations, and also targeted information for the public, which should include information about infection prevention and control measures for safe COVID-19 vaccine delivery. In addition, we need to really pay particular attention to ensuring a clean, hygienic, and well-ventilated environment, including appropriate waste management and adequate spaces to facilitate best IPC practices during the COVID-19 vaccination activities. So WHO provides guidance on all these aspects. However, we also recommend to consult and follow national guidance and protocols for infection prevention and control measures and for general operations for delivering COVID-19 vaccines. Our document, which I mentioned earlier, that is the aid memoir, which is being referenced several times in this presentation, includes guidance related to the preparation and planning phases of the COVID-19 vaccination activities, which obviously cover many aspects, but relevant for IPC, we have to make staffing considerations, development of guidance and SOPs, environmental considerations and engineering controls that are needed, and ensuring adequate supplies for infection prevention and control. During the operational phase, which is when the vaccines are delivered during vaccination sessions, there are key measures for infection prevention and control to be considered. Hand hygiene, appropriate use of personal protective equipment, injection safety principles, and environmental cleaning and disinfection and waste management. So for guidance and SOPs, first of all, WHO recommends that for any operations related to the COVID-19 vaccination delivery, there should be an infection prevention and control focal point to support guidance and SOPs development, to support training, and for the supervision of vaccination activities, and also supply, procurement, and management. From the staffing point of view, WHO also recommends that there should be an adequate number of vaccinators, depending on the population to be vaccinated. In addition, based on the advice and input of the IPC focal point, there should be local guidance and standard operating procedures related to screening policies for people to be vaccinated, including screening for COVID-19 signs and symptoms and other exclusion criteria. Also guidance and SOPs for IPC measures to be taken by anyone in the vaccination area, and also specifically for safely administering the COVID-19 vaccines. Guidance should also be available for cleaning and disinfection of the environment, for appropriate waste management. Also, visual reminders should be developed related to these various principles, and training materials for staff and educational and informational materials should be developed for the public. In terms of IPC supplies, it is certainly important to estimate and secure adequate supplies related to medical masks, other personal protective equipment, and then a number of items that are really needed to safely deliver the vaccine, including supplies for hand hygiene, supplies for performing screening for COVID-19, and obviously waste bins, safety boxes, equipment for cleaning and disinfections, etc., and etc. And there should be adequate areas for storage of these supplies. From the point of view of setting up the vaccination sites, we need to take into consideration a number of environmental and engineering controls which are meant to really allow and facilitate the safe rollout of the practices and the implementation and embedding of infection prevention and control measures. So, for instance, if the vaccination is delivered in a building, in a healthcare facility or vaccination center, there should be a separate entry and exit point with one-way flow of patients. There should be an adequate area for screening. There should be wide spaces to allow physical spacing, physical distancing of clients and also health workers. And indeed, the vaccination stations should be set up at least 1 meter apart. There should be adequate ventilation. We will talk about this in a minute. Adequate hand hygiene stations, both for the clients while being in the building or in the area, but especially at the point of the vaccination delivery, so at each vaccination station. There should be adequate space for vaccine storage and preparation. Signage should be prepared to set up the site, including reminders about the criteria, exclusion criteria, including signs and symptoms for COVID-19, about hand hygiene and respiratory hygiene, mask wearing, physical distancing, and other aspects that need to be adhered to, especially by the clients, but also by health workers. The areas should be cleaned regularly, and they should be set up for being easily cleanable. And also, there should be in place an adequate system for waste management, including safe disposal of sharps. So in the next slides and pictures, you can see some examples of these engineering and environmental controls. For instance, for the ventilation aspect, which is quite key in the context of the current pandemic, there might be areas that are naturally ventilated. In those areas, you should ensure, in particular, to open windows and doors in indoor spaces to allow airflows. And if outdoor, pick up a well-ventilated area. If instead the building has a mechanical ventilation system, the ventilation rate in the rooms that are used for the vaccination should be at least 6 air changes per hour. But also the national or international regulations for heating, refrigerating, and air conditioning should be adhered to or referred to. The next point is really the distancing, so ensuring adequate physical distancing of at least 1 meter in all directions among people waiting, but also among anyone, between anyone present in the area where the vaccination takes place. As I said earlier, there should be mechanisms to avoid overcrowding and long waiting times. So for instance, having good arrangements for schedules for people to present for the vaccination, it's one way to ensure avoiding overcrowding and avoiding long waiting times. A clear protocol for screening, especially for COVID-19 signs and symptoms, but also for other factors, should be set up. And as I said, the flow, one-way flow, setting up entries and exit sites that are separate from the main facility, if it's a healthcare facility that is used for other care, is important. And also avoiding positioning the vaccinator face-to-face with the vaccine recipient. Then looking at specific IPC procedures during the vaccination administration, we, as I said, need to pay attention to specific aspects. The first one is hand hygiene. So vaccinators should always perform hand hygiene before putting on and removing PPE, in particular mask, before preparing the vaccine, and between each person vaccinated or vaccine administration. It is clear that, especially for the latter, for the latter indication, which is critical, there is need for one hand hygiene action every vaccine administration. And this is best achieved, obviously, having a bottle of alcohol-based hand rub at the vaccination site, which is readily available. This can also be achieved by having hand hygiene stations, hand washing stations, such as, for instance, Veronica buckets set up at the point where the vaccination is delivered. The next point is personal protective equipment, which is based on some key principles. So from the one hand, the principle is that for administering a vaccination and for administering an intramuscular or intradermal injection, you don't need specific PPE. And therefore, the use of PPE should be done according to risk assessment, which means that specific PPE such as gowns, gloves, and eye protection or face shield are needed depending whether there is a specific risk. For instance, when dealing with vaccine adverse events, which could involve blood or body fluids exposure, or when you would like to prevent exposure to non-intact skin in specific situations, or if during the screening process there might be a suspicion of a COVID-19 case. If not, if you're not in those situations, specific PPE are not indicated apart from the medical mask that the vaccinator should wear in the context of the current pandemic, as well as the person receiving the vaccine, usually a fabric mask or a medical mask, depending if the person is a high-risk or vulnerable person having underlying diseases, for instance. What is important to remember, apologies, but there is a delay in changing the slides. So what is important to remember is that when using a mask, you need to perform hand hygiene before putting on the mask and before removing the mask or when touching the mask. And the mask needs to be used appropriately, positioned appropriately, and worn throughout appropriately. And WHO provides guidance in different ways through posters, tiles, and as well as videos that explain how to appropriately use a medical mask. Regarding the use of gloves, we have undertaken consultations with all major international and national organizations in charge of public health and infection prevention and control, including, for instance, US CDC, European CDC, Infection Prevention and Control Africa Network, and many other organizations, and also some member states represented in our guidance development group. And all these experts agree upon the fact that gloves are not indicated for administering a vaccine, including the COVID-19 vaccine, mainly because for this type of injections, there is no risk of blood exposure. And also, well, of course, they may be indicated if there is any skin breakdown. So gloves are not to be used and also should not replace the need for performing hand hygiene between each vaccine administration or for other indications. The use of alcohol-based hand rubs on gloved hands is also strongly discouraged by WHO. I forgot to say that obviously these recommendations have also been agreed upon by UNICEF. Another point which is critical is obviously injection safety. We don't have time to go too much into the details, but obviously there are many key principles that are related to the preparation of the vaccine, the use of sterile, safety-engineered syringes and needles, in particular auto-disable syringes, ideally with a Sharps injury protection feature. The need for performing it in a clean space with appropriate hand hygiene, and also with skin cleaning if skin is dirty, and disinfecting with alcohol if indicated by the national or local policies. For waste management, obviously, it's very important to ensure safe disposal of sharps in appropriate puncture and leak-proof safety boxes, and to follow key principles such as closing and disposing safety boxes when they are three-fourths full. Dispose vials and other waste in separate containers or waste bag. And as a key principle, in general, waste from COVID-19 vaccination activities is not considered infectious waste or hazardous waste unless we are talking about PPE that is contaminated. In that case, obviously, they should be disposed as infectious waste. For environmental cleaning, follow the standard procedures for cleaning and disinfection and perform them frequently as it is necessary in the context of the current pandemic, at least twice daily with special attention to high touch surfaces, and more frequently if indicated by local policies. So in conclusion, I would like to recommend you to consult a number of resources that are indicated in these slides, and of course my slides will be available to all of you. Thank you for your attention, and I'm now very happy to answer any questions. So I need to know how we are going to deal with specific questions.
Okay, thank you very much for your presentation, Benedetta. And while you were speaking, there have been a lot of interaction on the chat with some questions and comments that will be a pleasure for me to actually go through. And I think one of the very first comments that we had at the very start of your presentation had to do with the distancing. Say it came from Samarendra Biswas that said, in many session sites in urban areas, space is a problem. 6 feet distance can hardly be maintained. But before that, there was, I think, Benson Lenayoke. He asked, what happens to facilities with limited space and poor supplies? And I think there is another participant that actually agreed with a comment about Ishawa Buhari that says at Samarendra Biswas, I totally agree with you, as spacing will be one of the biggest challenges expected to be faced in Nigeria when the rollout eventually happens. So it goes back to the very question, Benedetta, what happens in facilities where they have problems of space? How can they respect the distancing measures?
I really can understand this challenge. I've worked in Africa in different countries, and I know really the reality. I think that one way is the one I suggested and we suggested in our documents. It's really scheduling appointments in a way that people don't have to, there are no many people coming at the same time and don't have to wait for long times. I know it's hard, again, of course, but this is one of the suggestions. As you know, WHO recommends at least 1 meter. So this 1 meter, I don't think it's a major distance to be respected, but it should be really respected, at least 1 meter, which means that if you can ensure higher distances, even better. So I know it's difficult, but I think also organizing waiting areas in different spaces, outside, for instance, that is another option. I know that it's all difficult, but this is why really planning is one element. So being able to plan in time, to procure in time, as you could see from my presentation, WHO has really discussed intensively with other organizations, including UNICEF, to reduce really to the minimum and to the evidence base the need for specific PPE and for specific supplies. I see that in your chat there are also questions about ensuring PPE procurement. And as I told you, the really essential piece in the context of the pandemic is the mask, because it's recommended by WHO in any transmission scenario where you are in the context of healthcare facilities. Other PPE is not specifically recommended unless there are very specific risks that should be assessed. So again, the matter is having the supplies and use them appropriately and not inappropriately. You know that in the context of this pandemic, there has been a lot of inappropriate use of gloves, for instance, and eventually shortage of gloves. So gloves are not available eventually when they are really needed. So I think that following our recommendations would really ensure appropriate use of gloves and therefore ready availability of gloves when they are actually needed.
Thank you very much. Please, it will really be good for the participants in the room to be able to see you. So is it possible? We really want to request that you put on your video so that the participants in the room will have the honor of seeing you. Thank you very much. Now I'm going to two other questions from Hilary Okelo and Malatesh Undi. She said, Hilary Okelo says supply of PPE has been a major challenge in most of the developing countries. How will this challenge be addressed? And then we have Malatesh Undi that says many of the healthcare professionals are removing their face masks during or after vaccination for a photograph. How do you avoid this?
So the shortages, I fully understand and agree. I'm happy to say that WHO has supported procurement of PPE for low middle income countries extensively. So we are supplying through a clear mechanism, also in collaboration countries through their requests. So countries need to make orders, and there is a mechanism that WHO has set up to procure, for instance, personal protective equipment, but also other supplies for in the context of the pandemic. So countries should really apply for this, and we help as much as possible. We shipped millions of pieces of different types of equipment. So this is the way I suggest countries can take advantage from. However, the second point for shortages is really to apply principles and approaches which we call rational use of personal protective equipment, for instance, which means really making sure that you use personal protective equipment according to evidence and when it's needed. But also there are other mechanisms that can be put in place to rationalize the use when there are shortages, such as prolonged use of some personal protective equipment, or also reprocessing when it's done through safe procedures of some protective equipment. For instance, there is now evidence for the safe reprocessing of respirators and reuse following the contamination with specific methods such as dry heat or methylene blue methods. All of this is described in a document that we have available that is named Rational Use of Personal Protective Equipment, that it's available online. So these are ways of
ensuring to prevent shortages, but also ways to manage shortages when they happen in the best way possible. I hope I answered your question.
I hope.
And I think the other point is that you made is how to make people pay attention to these principles, and also pay attention, for instance, to safe use of masks. As I said earlier, there's a lot of education to be done to the public, so to the clients coming for the vaccination, and to the health workers. So we need to be able to use different messages, obviously, because the target audience has different level of knowledge, also sometimes different level of literacy. And we need to be able to use images rather than a lot of words, local languages, visuals, as I said. Really ensure this at the local level when people come to the vaccination site. Supervision is also very important. And this is why I mentioned it's really important to have someone who has knowledge in infection prevention and control, because these people can be present and try to facilitate adherence to these measures, really to the when people arrive, performing hand hygiene, keeping the distance, using the mask appropriately. So this is these are basic principles that, as you know, in Africa, for instance, have been used in many examples. Starting from EVD, Ebola outbreaks, not only in the countries which had the outbreaks, but also in the countries that prepared for the outbreaks. And there are very good examples. I think we should really be positive and build upon efforts made over the last years in the African continent, for instance, in the context of Ebola prevention.
Very much. Christian from Satabdi Mitra that said, should the vaccinators use sanitizer after injection? And it's in line with what Timothy Kuramba asked. I need some clarity on how often should a health worker sanitize or hand wash during vaccination. And Dr. Subendu Kumare says many IPC protocols are very clearly explained at Timothy Kuramba after each vaccination. So I wanted to get your thoughts on that. And then while you're doing so, you also talk about Imam Bello, who asks any guidance on the use of locally made face masks and PPEs?
Okay, so for hand hygiene, I confirm that it is really important to perform hand hygiene between two vaccines administrations. So basically, after finishing one injection, when the person leaves the vaccination session, and before the next one. So in between, it's the moment when it's important to do so for both the vaccinator and the person being vaccinated next. So as I said earlier, in terms of preparations and procurement, it's clear that if you have to do this between administrations, it's something relatively frequent. And it's important to do this. We all agree on that. There is high consensus among experts and agencies. So it means that having alcohol-based hand rubs available, it would be a major asset, because you have your bottle on the table or in your pocket, and you can use it on site. Hand washing with water and soap is less practical, because usually you need to move to a sink, and that's really difficult because it takes time. Another option is to set up Veronica buckets at each vaccination station. But again, as you know, performing appropriate hand hygiene with water and soap takes from 40 to 60 seconds, and it's longer time, and therefore it's not ideal when you have to do it frequently. Regarding the locally produced face masks, there are WHO has supported research and also provided specifications and principles related to the locally produced masks, which should be at least 3 layers, should respect specific principles of breathability, and these principles are all described in a document which is related to mask use. We issued the latest edition of this on the 1st of December. And again, you can very easily find this document on our website. You can also find on our website videos on making, locally making masks. And so there are steps and instructions provided through this video that is available on our website, and it was considered really quite useful actually to people to understand how to make up these 3 layers, which materials to be used, and so on.
Very much. And I'm seeing more and more questions that are coming up on the chat. Sharon Limo asks, with the many sanitizers in the market, what is the recommended alcohol percentage for a sanitizer to be effective?
Yeah, so it's between 60 and 70% alcohol content. And this is very important. And another element that you could look for when you are checking on a marketed product is that it is in the label, it is indicated that the product was tested according to the EN 1500 norm. So EN 1500. Which is a test, an efficacy test that provides security, let's say, for, in simple words, for the preparation.
We've actually run out of time, but I think since we started the session a few minutes late, we can still, this is a very important and interesting topic, and the interest is expressed also by the participants from their comments and the questions that are asking. So if you permit, we could take a couple of other minutes to take a look. And I want to thank Dr. Subendu Kumare. I would have also loved to listen to participants from the scholar community, like in India, where the COVID-19 vaccine has already been introduced. That is for them to share their experience on how they are trying to respect the IPC measures. But unfortunately, we have actually run out of time. We do hope another opportunity will present its distant future. That said, I want to look at Rosina Mystery that says, should there be one vaccinator in each room, or could we have 2 or 3 also?
Yeah, of course. As I said, first of all, it depends if we can maintain the distance of at least 1 meter between vaccination stations. And also a good ventilation, as I mentioned earlier. So whether it is natural ventilation ensured by creating airflows between windows and doors, or ensuring adequate mechanical ventilation through good maintenance, first of all, of the mechanical ventilation systems, and also ensuring the 6 airflows per hour.
There's a question here from
Air exchanges.
Victor Nauba that says, why is the bucket called Veronika's? I think that's the last question we are going to take today. It carries a bit of humor.
I don't know. It's a very good question. I will explore. Is there anyone in the chat who knows why?
Yeah, because through my mind, and so really thank you very much, Benedetta. Any last words before we close the session?
Well, I would like to thank all people in the chat I see are supporting the principles and the measures I explained, because it's really important to pay attention to specific measures, as I said, not using gloves because of no need, and also to be mindful about potential shortages and also cross-contamination, because, you know, gloves have been documented many times as a vehicle for bugs. And let's remember also that we talk about COVID-19 only all the time, but multi-drug resistant bacteria and other viruses are always circulating. And so there have been many outbreaks and many transmission demonstrations of other germs through gloves. So it's important to pay attention to this, to hand hygiene, to the use of the mask at this time due to the pandemic, and the other principles. So eventually, I don't think that the principles and measures recommended are excessively many. There are some which are critical, and we need to be careful not to do things that are useless. So I would like to thank everybody, and also to really wish you all the best in all your work, because you are those who do the work. So I see that there is someone who found where Veronica bucket comes from, and it's about, I was wondering indeed that it was linked to the person who invented this, and she's a woman, she was a woman. That's great. And her name was Veronica Beko. Beko. So thank you very much for organizing, and best wishes to everybody.
Thank you very much, Benedetta. And once again, thank you everyone for joining this session, for the wonderful comments in the chat.